Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification number 25. That is the anti-emetic drugs and drugs treatment of nausea and vomiting. So this classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. My dear students, I would like to request you, please watch this video until end. We have already seen 24 videos on the classification part. If anybody has not seen previous videos, please go in the channel's playlist and watch all the previous videos, because these videos are very important for your GPAT, Niper, Drug Inspector and Government Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these classification videos. So again, I would like to request you, please watch this video until end. My dear students, before starting actual classification of anti-emetic drugs, so you should know some physiology behind the vomiting process or emesis. Emesis and vomiting both are the same terms. Emesis बोले तो vomiting same term होता है दोनों, ठीक है? So before starting the actual classification, you should know the some physiology behind the vomiting. Vomiting क्यों होता है? Vomiting is nothing but a kind of reflex of your body. If there is any irritant drug, if there is any irritant chemical, if there is a toxins, if there is a poison in your GIT, it is to be removed from GIT, it is to be expelled from GIT, and for that your body has its own reflex, own mechanism to remove that toxins or poisons or irritant chemical from your GIT in the form of vomiting. So vomiting is a kind of protective reflex. वोमिटिंग क्या है? प्रोटेक्टिव प्लेस है. अगर आपके जीआईटी में कोई टॉक्सिन्स है या फिर कोई इरिटेंट ड्रग आ गया या फिर कोई आपके जीआईटी में पॉइजन आ गया, दैट पॉइजंस, दैट ड्रग, दैट इरिटेंट केमिकल, दैट टॉक्सिन्स वो बाहर जाना मांगता है. अदरवाइज वो क्या करेंगे आपका? दे कैन कॉज डेथ. ओके, दे कैन कॉज डेथ. सो दैट्स व्हाई इट इज टू बी रिमूव्ड, एंड फॉर द रिमूवल ऑफ दैट टॉक्सिन्स एंड दैट मटेरियल, so there is a vomiting, that is a protective reflex of your body. So vomiting protective reflex होता है, but in some cases it needs a treatment, in some cases it needs a treatment. Okay, so suppose you are suffering from vomiting due to chemotherapy, if you are suffering from vomiting due to disturbance in the balance, if you are suffering from nausea due to bad smell and all that, okay, so at that time you need a treatment. Okay, but before that you should know what is the physiology of vomiting. Physiology क्या होता है? vomiting होता कैसे है? So vomiting is nothing but the signal given by vomiting center. So vomiting center is nothing but the higher center located in the medulla oblongata. Vomiting center is the center in the medulla oblongata which gives efferent impulse to the GIT to produce vomiting. vomiting center क्या करता है? एक सिग्नल भेजता है किसको? GIT को, to produce a vomiting. बट ये कब सिग्नल भेजता है? जब इसको सिग्नल आता है. जब वोमिटिंग सेंटर को सिग्नल आएगा तब ये सिग्नल भेजेगा इमेजेस के लिए, वोमिटिंग के लिए. बट इसको कौन सिग्नल देता है? भेजता है. वोमिटिंग सेंटर विल गेट impulses, afferent impulses from different parts of your brain and different parts of your body. First, suppose you smell any bad smell. If you are getting very bad smell, so you will get vomiting. If you have seen any filthy food, बहुत ही सड़ा हुआ कुछ आपने देख लिया तो आपको वोमिटिंग आ जाएगी. सो दैट इज नथिंग. इफ यू आर सफरिंग फ्रॉम एनी इमोशनल प्रॉब्लम, देन intense behavior, intense depression, intense excitement, so that also stimulate the vomiting. So if you get any bad smell or if you see any bad sight or smell or psychiatric stimulus, that will stimulate the higher centers in the brain, that is the cerebral cortex. So cerebral cortex will be stimulated and it will send signal to the vomiting center to induce vomiting. That is the first. So first. Now second, suppose you are traveling in a bus. आप बस में जा रहे हो और बस में क्या होता है कि आपका हेड जो है कंटिन्यूसली शेक होते रहता है, ठीक है, बिकॉज ऑफ द इंडिया के रास्ते तो बहुत नामी है, मतलब उसमें गड्ढे वगैरह बहुत सारे होते हैं, तो आपका हेड शेक होते रहता है कंटिन्यूसली. व्हेन यू आर ट्रैवलिंग इन अ बस, so there is a continuous shaking of your head. Continuous shaking of head means there is a disturbance in the balance, right? Your body tries to maintain the balance. So that's why balancing center is stimulated continuously in the cerebellum. Now near to the balancing center there is one center known as a vomiting center. So due to disturbance in the labyrinth function or due to disturbance in the vestibular apparatus, vomiting center is stimulated. That will produce a vomiting. Vomiting center is stimulated by this afferent impulses from chemoreceptor trigger zone and nucleus tractus solitaris. Then splanchnic nerve. Splanchnic nerve, nucleus tractus solitaris and chemoreceptor trigger zone. So ये भी सिग्नल्स देंगे वोमिटिंग सेंटर को टू प्रोड्यूस वोमिटिंग. बट ये सिग्नल कब देंगे? व्हेन दिस दे विल गिव यू सिग्नल if there is increased 5 histamine 5-hydroxytryptamine, that is the serotonin in your GIT, so that signal will transmitted to CTZ and it will stimulate the vomiting center. So that's how there are 4 basic reasons for vomiting. Vomiting के लिए 4 basic reason होते हैं. कौन से? So we'll see one by one. So there are 4 reason for vomiting. So first reason is nothing but the vomiting center is there. So this is known as a vomiting center, and stimulation of vomiting center by any stimulus will result in the emesis. Now vomiting center is stimulated by this first reason for your emesis, that is a first reason for emesis. So if you have any fear, if you got a emotional, if you have had a very bad smell, if you see something very filthy, so that stimulate your cerebellum, that is a higher center present in the cerebellum, and that stimulate the vomiting center to produce the emesis or vomiting, right? Second reason for this vomiting, if you are traveling in a bus, there is a continuous alteration of head and your body try to maintain a balance, and that stimulate the balancing center in the cerebellum, which also stimulate the vomiting center, that result in the vomiting. Now third reason for your vomiting, that is this third reason for your vomiting. Suppose if any toxins are there in your GIT, if any irritant drugs are there, if any irritant chemicals are there, so they will cause release of 5-hydroxytryptamine or serotonin in the stomach, and that will stimulate the chemoreceptor trigger zone and area posterma in the brain. वहाँ पे in that area you have serotonin, then dopamine and cholinergic receptors, right? Now again, fourth reason for your vomiting is nothing but the stimulation of NTS. NTS means nucleus tractus solitaris. Okay, so increase the serotonin in the small intestine or stomach, that stimulate the nucleus tractus solitaris, which will have again serotonin, dopamine, muscarinin and histamine receptors, and this NTS finally stimulate the emetic or vomiting center. So vomiting center is stimulated by 4 signals. vomiting center को सिग्नल कहाँ से आता है? 4 जगह से आता है. पहली जगह कौन सी है? पहली जगह है सेरेब्रम, हायर सेंटर्स फ्रॉम सेरेब्रम. अगर आपको कोई बहुत ही ज्यादा फियर है, आप बहुत ज्यादा डर गए, सो अगर आप बहुत ज्यादा इमोशनल हो गए, सो स्मेल अगर बहुत गंदा स्मेल आ गया, या फिर आपने बहुत गंदी चीज देख ली, तो उसके हायर सेंटर स्टिमुलेट होते हैं, वो स्टिमुलेट करेंगे वोमिटिंग सेंटर को, एंड वो प्रोड्यूस करेगा वोमिटिंग. अगेन अगर आप बस में ट्रैवल कर रहे हो, तो वह कंटिन्यूअस शेकिंग ऑफ हेड होता है, एंड बॉडी ट्राई टू मेंटेन अ बैलेंस पोस्चर, एंड दैट्स व्हाई बैलेंसिंग सेंटर इज स्टिमुलेटेड व्हिच इज प्रेजेंट इन द सेरेब्रम. वो स्टिमुलेट करता है अगेन वोमिटिंग सेंटर को टू प्रोड्यूस वोमिटिंग. तो ये 2 रीजन हो गए. नाउ थर्ड रीजन फॉर वोमिटिंग इज नथिंग बट द स्टिमुलेशन ऑफ chemoreceptor ट्रिगर जोन एंड एरिया पोस्टर्मा. इसको कौन स्टिमुलेट करेगा? सपोज इफ यू हैव टॉक्सिन्स, सम irritant chemicals, some poison in your GIT, that will release the serotonin in the GIT, that will stimulate the chemoreceptor trigger zone. CTZ में देखो 5-hydroxytryptamine मतलब सेरोटोनिन, डोपामाइन 2 एंड मस्कर्निक 1, मतलब यहाँ पे डोपामाइन, सेरोटोनिन, आयोनिक, मस्कर्निक रिसेप्टर्स होते हैं. It will stimulate the vomiting center. That is the third reason for vomiting. Now fourth reason for vomiting is nothing but the stimulation of nucleus tractus solitaris. Increase the serotonin level in the GIT will stimulate the NTS, which will also have serotonin, dopamine receptor, muscarinic receptor and histamine receptor. तो जितने भी रिसेप्टर है देखो यहाँ पे serotonin receptor, dopamine receptor, muscarinic receptor and histamine receptor. So all these are involved in the vomiting. This nucleus tractus solitaris finally stimulate the vomiting center to produce vomiting. So there are 4 reasons, 4 stimulus who stimulate the vomiting center, right? तो वोमिटिंग सेंटर को स्टिमुलेट करने वाले 4 स्टिमुलस होते हैं, एंड वही 4 स्टिमुलस अगर आपने ब्लॉक कर दिए तो आप vomiting को prevent कर सकते हो. So that's they are nothing but the targets for anti-emetic drugs. So that's why you can see over here 5-hydroxytryptamine, okay, 5-HT3 antagonists are also used. D2 receptor antagonists are also used as anti-emetic. Anti-muscarinics are also used as anti-emetics. Antihistamines, they are also used as anti-emetics. So you are getting a 4 targets over here for anti-emetic drugs. Again you can see same thing. So vomiting center is there. Vomiting center will get stimulus from vestibular system or labyrinth due to alteration of your head. So in that you have muscarinic receptor and histaminic receptor which will stimulate the vomiting center to produce emetic. Emesis or vomiting. Again in the GIT, if there is any irritant is there, so it will increase the serotonin level which will stimulate the vomiting center to produce vomiting. In the chemoreceptor trigger zone, some factors stimulate the chemoreceptor trigger zone, like in that you have D2 receptors, then neurokine receptors, then serotonin receptor which will stimulate the vomiting center. Now this is the reason for vomiting. We will see in the details. So as I have already told you, there are 4 reasons for vomiting. So first, this is known as a vomiting center, and stimulation of the vomiting center by different impulses, by different signal will leads to vomiting. Vomiting center को जो कोई stimulate करेगा वो उसके बाद में क्या होगा, vomiting होगा. Now vomiting center को कौन stimulate करता है? First, smell, pain, sight and psychogenic stimuli. ठीक है, आपने कोई गंदा स्मेल देख लिया, गंदा चीज देख लिया, स्मेल किया, या फिर आपको बहुत ज्यादा पेन है, दर्द है, psychogenic stimuli है आपको, psychogenic stimuli, so that will stimulate the higher centers in the brain, in the cerebral cortex, which will stimulate the vomiting center to produce vomiting. That is the first reason for vomiting. Now second reason for vomiting is nothing but the motion. For example, if you are traveling in the bus, due to continuous alteration of your head, your body will try to maintain a balance, and for that it will stimulate the balancing center. So motion, altered motion, or there are certain ototoxic drug also, they causes the alteration in the balancing center which will stimulate the vomiting center to produce the vomiting, right? That is the second reason. Now third reason is nothing but the GIT. So if there is any irritation, GIT irritation, or chemotherapy or radiation, infection, or certain drugs which will irritate your GIT, so there is a release of 5-hydroxytryptamine which will stimulate the nucleus tractus solitaris, and this nucleus tractus solitaris will have 5-hydroxytryptamine, muscarinic receptor, histamine receptor which will stimulate the vomiting center to produce a vomiting, right? Now fourth reason is nothing but this, okay? In the blood vessel, if there is increased serotonin level due to cytotoxic drug, levodopa, apomorphine, digitalis, ergot, morphine, emetic, so they will stimulate this chemoreceptor trigger zone, and due to stimulation of chemoreceptor trigger zone will stimulate the vomiting center to produce a vomiting. So vomiting center को stimulate करने वाले देखो, एक साइड पेन, साइकोजेनिक स्टिमुला फ्रॉम कॉर्टेक्स, सेरेब्रल कॉर्टेक्स स्टिमुलेट वोमिटिंग सेंटर. दूसरा रीजन वोमिटिंग सेंटर को स्टिमुलेट करने वाला है GIT में अगर कोई इरिटेशन वगैरह हो गया, so that will stimulate the nucleus tractus solitaris, that will stimulate the vomiting center and vomiting. तीसरा रीजन होता है आपका ये, if there is imbalance, continuous imbalance of your body, so cerebellum will be stimulated, balancing center will be stimulated, it will stimulate the vomiting center to produce vomiting. फोर्थ रीजन होता है chemoreceptor trigger zone. So these drugs like cytotoxic drug, levodopa, apomorphine, these drugs also stimulate the vomiting CTZ, and chemoreceptor trigger zone stimulation will stimulate the vomiting center to produce vomiting. So this is the physiology, and that's how vomiting is induced, right? अगर आपको ये मालूम होगा कि vomiting कैसे होता है, तो आपको मालूम पड़ जाएगा कि कहाँ पे टारगेट्स है, और अगर आपको टारगेट्स मालूम हो गए तो आप यहाँ पे एंटी-एमेटिक ड्रग का क्लासिफिकेशन इजीली याद कर सकते हो. Now we'll see the classification of anti-emetic drugs. First one is nothing but the anticholinergics, or it is also known as the anti-muscarinic drugs. So in that you have hyoscine, dicyclomine, atropine and scopolamine. Hyoscine, dicyclomine, atropine and scopolamine. So these drugs, they are known as the anti-muscarinic drugs. They will block the afferent impulse which is connected to a vomiting center. ये क्या करेंगे, जो impulse होता है उसको block करेंगे, right? So out of that, dicyclomine is also used as a muscle relaxant in the Kolke pain. So if you are getting a spasm of your smooth muscles, dicyclomine is Semisynthetic derivative of atropine used as a antiemetic as well as smooth muscle relaxant. Now I have seen atropine scopolamine is most commonly used as an antiemetic from this anticholinergic category. Now second class will be antihistaminic. Second class will be your antihistamine drug. Second class will antihistaminic drugs. So as you know that histamine plays very important role in the vomiting pathway. So antihistaminics they are used as a antiemetic drugs. So in that you have promethazine, diphenhydramine, dimenhydrinate, doxylamine, meclizine. This doxylamine along with the vitamin B6. This doxylamine along with the vitamin B6 it is used in the prevention of vomiting in the pregnancy. Vitamin B6 and doxylamine it is used in the treatment of vomiting due to pregnancy. Pregnancy में जो vomiting होता है उसमें doxylamine and vitamin B6 use करते हैं. Right now we'll see the next class. Third class is nothing but the neuroleptic drugs or dopamine 2 receptor antagonists. So antipsychotic drugs also they has a antiemetic effect like chlorpromazine, triflupromazine, prochlorperazine, and other haloperidol, etc. Because these drugs block the dopamine receptor, and now I have already explained you dopamine is not only present in the postrema, it is also present in the chemoreceptor trigger zone. Blocking of dopamine receptor in the CTZ produces antiemetic effect. So chlorpromazine is known as a large active, triflupromazine, prochlorperazine. Okay. These are the D2 receptor antagonists. Now prokinetic drugs. Prokinetic drugs means fourth class is nothing but the prokinetic drugs. Prokinetic drugs means they will increase the peristalsis of EOGIT. So in that you have metoclopramide, domperidone, cisapride, mosapride, and etopride. Right. So out of that, metoclopramide, domperidone, they block the D2 receptor. Again, dopamine 2 receptor blockers. Cisapride, mosapride, and etopride. All these are the prokinetic drugs. They will increase the peristalsis, right? Your anti-emetic drug. So, hydroxytryptamine receptor antagonist or serotonin receptor antagonist. So, in that you have all the cetrons. इसमें सब cetrons रहेंगे. Ondansetron, granisetron, palonsetron, and ramosetron. So, all these cetrons are known as a 5-HT3 receptor antagonist. 5-HT3 receptor antagonist or serotonin antagonist. And remember, these are the drug of choice in case of vomiting induced by anti-cancer drugs. So these cetrons are the drug of choice in the treatment of vomiting induced by chemotherapeutic agents, right? So out of that, this ondansetron is the short-acting drug. Ondansetron is a short-acting drug. Palonosetron is the most potent drug among the cetrons. Palonosetron is the most potent drug as well as longer acting drug. ये most potent भी होता है, longer acting भी होता है. This is a slower acting, right? These are the fifth class. Now sixth class is nothing but the neurokinin 1 receptor antagonist, or also they are known as a substance P antagonist. So in that you have aprepitant and post-aprepitant. Aprepitant and post-aprepitant. The post-aprepitant is nothing but the active. It is a prodrug of aprepitant. Post-aprepitant is a prodrug of aprepitant. Now seventh class of your anti-emetic drugs, that is nothing but the adjuvant anti-emetics, or you can say this one is a steroidal drug, dexamethasone. This one is a sedative, benzodiazepine. Then dronabinol is a cannabinoid. Nalbinone and dronabinol is a nabilone is nothing but the, and dronabinol is nothing but the cannabinoids. Nabilone and dronabinoids, they are cannabinoids. Classification of anti-emetic drugs. So hydroxytryptamine receptor 3 antagonist or anti-serotonin drug. So all the cetrons, ondansetron, granisetron, polosetron, and all that way. Dopamine 2 receptor antagonist, D2 receptor antagonist. So all the phenothiazines and all that. Domperidone, then metoclopramide. So out of that, metoclopramide, domperidone, they are also known as the prokinetic drugs. Then antihistaminic drug or H1 receptor blockers. Sinerzine, meclizine, hydroxine, etc. Antimuscarinic scopolamines, atropine, and dicyclomine. Cannabinoids or cannabinoid agonists like nabilone. Then corticosteroids like dexamethasone, benzodiazepine like alprazolam diazepam. Combination of these drugs also used. So 5-HT3 receptor antagonist or prokinetic drug along with the steroid drug. Combination also used in the treatment of vomiting. You can see over here condition and drug used in the that condition. देखो पहले होता है motion sickness due to disturbance in the motions or head motion. So vomiting is there, and in that iosine is there, cyclizine is there, promethazine and cinolozine. These are the drug used in the motion sickness. Now vomiting due to cytotoxic drug or vomiting due to anti-cancer drug. Vomiting due to anti-cancer drugs. So in that you have ondansetron, dexamethasone combination. They are also used. In that also we have metoclopramide, dexamethasone and diphenhydramine lorazepam combination. So vomiting due to cytotoxic drug. Now vomiting due to other drugs, irritant drugs. So in that chlorpromazine and metoclopramide is used. Post-operative vomiting. So in that this ondansetron metoclopramide is used. Vomiting in the pregnancy, in that these drugs are used like dicyclomine, pyridoxine, cyclizine, meclizine and metoclopramide again. Other important points from anti-emetic drugs. So these points are very important. Anti-muscarinic and antihistaminic drugs are used for the prophylaxis of motion sickness. अगर आपको vomiting हो रहा है motion sickness के कारण, so anti-muscarinic drugs and antihistaminic drugs are used for the prophylaxis, prevention of motion sickness. आपको अगर गाड़ी लगती है, मतलब आपको अगर ट्रैवलिंग की वजह से वोमिटिंग होता है, सो इन दैट केस ट्रैवलिंग के पहले आप आयोमिन नाम का एक टैबलेट मिलता है, उसमें प्रोमेथाजिन होता है, तो प्रोमेथाजिन ले लो, आपको वोमिटिंग नहीं होगा. सो दैट इज एंटीहिस्टामिन. So they are used for the prophylaxis or prevention of motion sickness. Second one is nothing but the combination of doxylamine and pyridoxine. Combination of doxylamine and pyridoxine. It is the safest antiemetic in the pregnancy. So antiemetic जो है in the pregnancy, doxylamine and pyridoxine का combination ये safest antiemetic है, because उसमें आप D2 receptor agonist use नहीं कर सकते. Because D2 receptor agonists, they can cause extrapyramidal symptoms, right? They can produce Parkinsonism. So safest combination antiemetic drug in the pregnancy क्या है? It is nothing but the pyridoxine and doxylamine. Doxylamine is nothing but the antihistaminic drug. Pyridoxine is nothing but the water soluble vitamin. Next point we'll see serotonin receptor antagonist, that is the satrons. All the satrons, granisetron, pavlosatron. All these are the drug of choice in case of chemotherapy induced vomiting or radiation induced vomiting. Now we'll see the aprepitant. Aprepitant is the drug. It is a new drug. Aprepitant is a new drug known as selective neurokinin 1 receptor antagonist or substance P antagonist. It is a drug of choice in the delayed vomiting due to cisplatin. Cisplatin is nothing but the cisplatin क्या है? Cisplatin is nothing but the anti-cancer drug which has a highest potential to produce vomiting. Highest potential to produce vomiting is nothing but the having cisplatin. Cisplatin produces vomiting, immediate vomiting and late vomiting. So for the early vomiting 5-HT3 receptor antagonists are used, and for late vomiting this aprepitant is the drug of choice, right? Now fosaprepitant is a prodrug. Fosaprepitant is a prodrug for aprepitant. Nitiprepitant is a similar drug to the aprepitant. Pronabinol is an antiemetic acts by stimulating the CB1 receptor, cannabinoid 1 receptor. Also it is an appetite stimulant. Now emetics मतलब क्या है? We have seen the anti-emetic drugs. Now emetics मतलब these are the drugs which produces the vomiting. ये आपको vomiting produce करेंगे emetics drugs. Now why you need to produce vomiting? Suppose that your GIT as a toxins. Suppose that if you ingest some, so in that case you need to induce vomiting, right? These drugs either they act on a chemoreceptor agonism. Example is apomorphine. So emetics का भी classification यहाँ पे देखो. Apomorphine will act on a chemoreceptor agonism, will stimulate the chemoreceptor agonism, right? So it is also known as centrally acting drug. Apomorphine centrally act on a chemoreceptor trigger zone and stimulate the CT cell, induces the vomiting. So reflex stimulant, it is known as a central stimulant as well as peripheral stimulant. So epicacona, it is a alkaloid obtained from Sapellis epicacona. Right. Third is nothing but the reflex stimulant to GIT. It is known as a peripheral stimulant. जो पहला होता है, they are known as centrally acting drugs और acts on a CTZ, apomorphine. दूसरा क्लास जो है centrally plus CTZ को, मतलब centrally plus peripheral. So reflex stimulant plus CTZ. So epicacona. And third one is nothing but the reflex stimulant of GIT. So for example, powdered mustard, strong salt solution, hypertonic sodium chloride solution. अगर आपने hypertonic sodium chloride solution दे दिया तो उसको vomiting हो जाएगा. क्यों? Because that so hypertonic sodium chloride will withdraw all the fluids from your GIT, and that signal, irritation signal, will be sent to CTZ. That will produce vomiting, right? So you can order this magic bullet for GPAT Niper DI Pharmacist. Read 2-3 times and qualify 100%. It's our guarantee with a very good rank. We have very much promising results from past few years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course where you will have live lectures, recorded lectures. All these will be subject wise. Study material will be provided to your address in the form of hard copy. Everything is there in a 8,000 including test series. And if you get all in rank below 20 in the GPAT, your fees will be returned in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100%.